Hello and welcome to Health Talk, where all we do is talk health. My name is Oluwatoyin Abo. The last time I promised to bring Dr. David Ikudaisi back on the program. This morning he's back and he'll be educating us on how to use regenerative medicine to treat male and female sexual dysfunction. You're welcome, Dr. David Ikudaisi.
Thank you, Tony Abo.
Before we proceed, let's have you first understand what male and female sexual dysfunction is all about.
Yeah, the male and female dysfunction has to deal with their, sexual ability to be able to perform the right way. Picking the female sexual dysfunction first, there are out there in marriages some women who have lost desire in enjoying their relationship with their husband. So there's lack of desire. Some people may never experience orgasm before, or maybe they barely experience it. Some people have pain when they're with their spouses, with their husbands. So due to lack of lubrication or dryness due to age. So there are many causes of female sexual disorder. Likewise, men are not left out. Men too have sexual dysfunctions, either in form of inability to maintain erection, or maybe having premature ejaculation, or some people may even have loss of sensation. So that prevents them from even able to have a proper or maintain their erection.
Looking at female and male sexual dysfunction now, how useful is regenerative medicine in the treatment of those particular issues?
In US, there's a doctor by the name Ronels in Alabama, state of Alabama. He invented a procedure called P-shot or P-shot or pre-post shot for men, and O-shot or orgasm shot for women. And this is just using simply platelet-rich plasma therapy, and whereby you use the patient's own blood, to address the issue. You get the platelets from the plasma, activate it, and reject it into the male or female organ, and that starts to rejuvenate and regenerate those tissues, and that restores the issue. Well, there are other causes of the male and female sexual dysfunction as well. The psychological is there, the stress, mental, those have to be addressed as well.
Let's assume that a patient comes to you and you want to take them into the theater. Explain to us what the scenario will look like.
The procedure is simple, it's not painful. We take, from any of the patients, we take their blood, in syringes, and then we process that using a centrifuge in a certain way. And then what we are looking for is the plasma. And there's a section of that plasma that is very rich in platelets. That's why it is called platelet-rich plasma. And those platelets have growth factors. So the growth factors is what we now reintroduce in case of men into the shaft of their private part, and in case of women also into their organ, their sexual organ. And these growth factors now go into action, and they start creating new blood vessels and making the tissues to regenerate. If it's a man, it can grow longer in length and in width, and also help their stamina. In women, it increases lubrication, it increases their desire, and it also helps women to have an orgasm if they never had one, or strengthen it if they barely have a regular one.
No drugs or any medication in use in this process?
There is no medication. Everything is done in the presence of the patient. No medication, just doing the collection of the blood, processing of the blood, activating the platelets in it to release growth factor, and then giving it back to the patient where it is needed.
Do you think this will work on Africans?
Well, God created all of us the same, except for the color of the skin. So if it works with very, very great results in the US, it can also work in Africa. And that being said, there are also black patients in America that have tried this and their marriages have been, saved.
Well, it has been nice having you on the program this morning. You still have to come back again because we still have so many topics to talk about.
Thank you.
Thank you very much for being part of the program. Well, that was Dr. David Ikudaisi educating us on the treatment of male and female sexual dysfunction using regenerative medicine. My name is Oluwatoyin Abo. Join me next time. Bye for now.